let's talk about the bipolar.
Mm-hmm.
What is bipolar? Because we're hearing more about it these days. I'm pleased we are, and I'm following the Ian
Campbell.
Ian
Yes.
Campbell's podcast as well on bipolar, and
Yes.
it's fascinating to learn more about it. So, can we talk about bipolar disease
Yeah,
and
of course.
how the carnivore diet, or how at least the meat-heavy diet may help the symptoms?
Yeah, so bipolar disease, some people might know it as manic depression, is what it would have been called previously. And it simply means that somebody has experienced episodes of either just mania or hypomania, which is a lesser version of mania, not quite so severe. Or people typically have episodes of depression as well. So it tends to be intermittent episodes of either depression or mania. And people can become psychotic in the context of severe depression or severe mania, but mostly you're looking at mood symptoms. It can be extremely debilitating. Some people develop rapid cycling illness, which is when they have multiple episodes in a year. And the evidence shows that people with rapid cycling bipolar, so lots of episodes in 1 year, are much more likely to have insulin resistance than not. And there's I think it may be a Canadian researcher who's published some research, and she works in the name just escapes me, but she works in a clinic for treatment resistant people. So she does see a lot of people with major mood disorders like bipolar. And it was very interesting listening to her speak about her study. So she had patients who'd responded to lithium, which would be the gold standard medication within mainstream psychiatry for bipolar disorder, to lithium as a mood stabilizer. And she was seeing cohorts of people who used to respond to lithium, but as they got older, no longer did. And when she was able to reverse their insulin resistance, I think that study was using metformin, but diet would be another way of doing that. She was able to bring those patients' symptoms under control again with their treatment. So yeah, I'd actually been involved in a study recently with Ian Campbell, because we're both based in Edinburgh, and it was a pilot study of a ketogenic diet in bipolar disorder, and there were some really interesting results from that. So some people who did very well and have chosen to continue on with the diet. So it's certainly a treatment modality. It's just the research isn't quite up to date, unfortunately, because there's no drug company that's going to fund a trial into something that they can't patent. Let's be honest at the end of the day.
Yeah. Have you published the study?
So it's been submitted to a journal, so we're just waiting to hear back.
Yeah, I'll look forward to it, and at some point when it's published, I'll put add the link to the video description as well.